Why wisdom teeth need to be taken out. Problems with impacted wisdom teeth relate to infection of the operculum, operculum, comma, decay in the wisdom tooth, comma, decay in the adjacent teeth, comma, food packing and gum disease. Let's look at each of these problems that can occur with impacted wisdom teeth in turn. Number one, infection of the operculum. Underline that. As mentioned previously, the operculum is simply a gum flap which covers wholly or partially part of the wisdom tooth. It is quite easy for the operculum to become infected or inflamed. Full stop. The way the operculum does get infected or inflamed is when food or plaque becomes trapped underneath the gum flap, which is overlying the wisdom tooth. Full stop. When the plaque or the food has been there for a while and it is not being removed on a daily basis with your toothbrush and mouthwashes, comma, this gum flap becomes infected or inflamed. Full stop. The symptoms that you will get from an infected or inflamed operculum are those of pain on the gum flap, comma, swelling of the gum flap, comma, and just general soreness around the whole area. Full stop. An operculum problem occurs much more often on lower wisdom teeth than upper wisdom teeth. Full stop. Nearly all of the problems that you do get with an infected or inflamed operculum relate to a lower, partially erupted, impacted wisdom tooth. Full stop. Interestingly, comma, when the operculum or gum flap does become swollen and infected, the tooth immediately above it often then will bite down on this gum flap or operculum. Full stop. When the tooth above starts to bite on this gum flap, comma, the gum flap will get traumatized, and in doing so, comma, it becomes even more swollen and even more infected. Full stop. This phenomenon, however, can be used to our advantage because one of the treatments for an impacted and painful wisdom tooth is to remove the opposing tooth, full stop. Often the opposing tooth will simply be the upper wisdom tooth, which you are probably going to have to remove anyway, full stop. It is not uncommon for a patient to be booked in to have an upper and a lower wisdom tooth taken out, for example, on one side of the mouth, and when the upper wisdom tooth has been taken out, it sometimes then no longer becomes unnecessary to take out the lower wisdom tooth out as well, full stop. Once the operculum no longer is inflamed or red or sore, then often it just can be left like that, as long as you make sure that it is being cleaned every day properly, full stop. The best way to clean the gum flap or the operculum is threefold, full stop. In brackets, A, just brushing normally as you would do with all your other teeth, you can tilt the head of your toothbrush so the bristles actually get right under that gum flap, full stop. You will know that you are cleaning the operculum properly because you will be able to feel the bristles of your toothbrush getting right underneath the gum flap, and you're almost massaging the gum around it, full stop. Do not worry if while you are brushing under the operculum, the operculum feels a bit sore and a bit painful, or even you may get some bleeding from it as well, full stop. In fact, if you do get soreness or bleeding while you are brushing the operculum, that is actually good, because it indicates that the operculum is in fact inflamed, and therefore you are getting food or plaque trapped underneath it, full stop. So, by cleaning underneath the operculum, you are getting rid of all the plaque and the food that is being collected underneath it, which in turn over a period of time will prevent any infection or inflammation of the operculum, full stop. In brackets, B. Often a normal toothbrush will only be able to get up to a certain distance under the operculum for cleaning purposes, full stop. Therefore, it will also be necessary for you to buy a small interdental toothbrush, full stop. You can buy an interdental toothbrush from our practice, or you can buy an interdental toothbrush from any chemist, supermarket, and even online, full stop. An interdental toothbrush is simply a toothbrush with one or two tufts, full stop. In this way, the interdental toothbrush can get right under the gum flap, full stop. You will need to use an interdental toothbrush to clean out the operculum in front of a mirror, full stop. At first it will be quite tricky to use because you are looking at the mirror and it's working like backwards to front, full stop. However, once you have got used to using an interdental toothbrush to clean out the operculum, you will quickly notice a big improvement, full stop. At first, it will be sore, it will bleed, and it may even become uncomfortable, however, as you are getting rid of all the food debris and plaque underneath the operculum, any inflammation or infection will be kept at bay, full stop. In brackets C. An important part of cleaning the operculum, as well as using your normal toothbrush and your interdental toothbrush, is to consider using a mouthwash as well, full stop. There are many different mouthwashes that you can use, full stop. Most of these mouthwashes will probably have no effect whatsoever around an operculum of a wisdom tooth, full stop. There are only 3 mouthwashes which will actually have some effect on an infected or inflamed operculum around a wisdom tooth, full stop. If at all possible, the best mouthwash for getting rid of pain around an operculum and also for keeping the operculum clean, is one that contains a chemical called chlorhexidine, full stop. Spelling CHLORHEXIDINE, full stop. There are only 2 or 3 brands of mouthwash that contain chlorhexidine, full stop. Examples are Corsodyl, CORSODYL, which can be available as the original flavour or a mint flavour, full stop. Chlorhexidine is actually a very, very strong mouthwash, and you will notice when you are using it in your mouth, you will get a slight burning sensation, especially if there already is some inflammation or infection around the operculum, full stop. The chlorhexidine mouthwash must be kept over the operculum for at least 1.5 minutes, full stop. You must time that on your watch that you are holding the mouthwash on the operculum for at least 1.5 minutes, full stop. Once 1.5 minutes is over, you simply just spit out the chlorhexidine mouthwash, full stop. It is important not to rinse your mouth out with water afterwards, because you want to keep the chlorhexidine mouthwash in contact with the operculum so that it continues to work, full stop. You may think that eventually, after a very short time, there will be no corsedil left around the operculum anyway, because your saliva will have diluted it and some of it you will have swallowed, full stop. However, chlorhexidine works by actually binding onto the soft tissues of your mouth, so that its action full stop, sorry, so that its action continues for over a long period of time. As mentioned above, chlorhexidine is a very effective mouthwash in preventing plaque and infection around an operculum, however, it tastes absolutely vile, full stop. Even after you have used the mouthwash and it has been spat out into the sink, the taste will linger on for many hours afterwards, full stop. You will in fact notice the altered taste in your mouth even the next day, full stop. But after a while, when you do notice that it is having a good effect on the operculum, full stop, you don't mind the taste that much, Unfortunately, another side effect of chlorhexidine mouthwash is that it will discolour your teeth as well, full stop. Before you start panicking that all your teeth may go black by using a chlorhexidine mouthwash, don't worry, full stop. Staining of your teeth by using chlorhexidine mouthwash is only temporary, full stop. The staining can be prevented by making sure you brush your teeth first and you actually remove every single last trace of the of the toothpaste before you start using the mouthwash, full stop. This is because some of the staining occurs when the chlorhexidine reacts with the remnants of the toothpaste that you have used, full stop. However, there will be some staining, and this is best removed by asking your dentist to give you a thorough scale and polish, full stop. Underline number 2 in brackets, decay in a wisdom tooth. One of the most commonest reasons for having a wisdom tooth taken out is dental decay or dental caries, spelt C-A-R-I-E-S, full stop. Often, it is simply not expedient to fill a wisdom tooth, full stop. One of the reasons why this is so, is because once you have removed decay and placed a filling inside a wisdom tooth, the decay will simply reoccur and you will be back to square one again, full stop. Decay in a wisdom tooth is often a very difficult procedure because the tooth is very far back in your mouth and it is just very difficult for the dentist technically to clean and fill the tooth, full stop. So, if decay is noticed in your wisdom tooth, it is usually better to have the wisdom tooth or teeth taken out, full stop. In brackets number 3 and underlined, decay in the adjacent teeth. A wisdom tooth or wisdom teeth are often taken out, not because of decay in the wisdom tooth itself, but in the adjacent tooth, full stop. An impacted wisdom tooth creates a food and plaque trap which causes decay in the adjacent tooth, full stop. At our dental clinic, we saw a patient a year ago who had some early decay in his wisdom tooth, full stop. We advised the patient to have the wisdom tooth extracted because we felt that the decay would reoccur, and in any case it was going to be very difficult to treat the decay, let alone place a filling in the tooth, full stop. The patient decided that they knew better and said that they didn't want to have the wisdom tooth taken out, full stop. A year later, the patient came back with a swollen face, bad breath and excruciating pain, full stop. By now, with the use of a dental x-ray, the decay in the wisdom tooth had spread into the nerve, and even worse, the decay had now affected the adjacent tooth, which was previously totally healthy, full stop. At this point, we had to then take out the wisdom tooth and the adjacent tooth as well, full stop. It didn't actually stop there though, because the tooth immediately above the wisdom tooth and the adjacent tooth at the top as well, became over erupted, overerupted, and they had to be removed as well, full stop. All in all, instead of just having one wisdom tooth out, the patient had now lost 4 teeth unnecessarily altogether, full stop.